The yoga pregnancy ball is a great tool for pregnant women. It helps to support your weight, which can be difficult when you're carrying around an extra 20 pounds. The ball also doubles as a comfortable place to sit and provides back support during labor. This article will discuss what the benefits of using a yoga pregnancy ball are and how it can help you make it through pregnancy. Is a yoga ball good for pregnancy? Yoga balls have been used as exercise equipment for decades. Over the past few years, they have become a popular tool to help pregnant women work out and keep comfortable during pregnancy. But can you really use a yoga ball safely while expecting? Is it worth the risk? The short answer: yes, you can use a yoga ball during pregnancy, but only if you're feeling good and healthy enough to do so. As with any exercise gadget, says Faith Domenico, senior editor of Fit Pregnancy, it's not worth risking your pregnancy simply to use a yoga ball. While the jury is still out on whether using a yoga ball during pregnancy can cause harm, there are some serious concerns that you should be aware of. What concerns are there? Doctors, healthcare professionals, and yoga teachers alike caution pregnant women to be wary of using a yoga ball. Although it might be tempting to get on the ball and bounce away at any point during your pregnancy, especially because you're already feeling so big and bulky, it's important not to treat your growing baby like an exercise toy. I wouldn't recommend it, says Cola Jones, president of Intuitive Flow Yoga Centers. The body is made for smooth movement in all planes, but once you sit on that ball, you immediately change the shape of your spine. And since breathing is paramount throughout pregnancy, for both mommy and baby, putting pressure on your torso could make it more difficult to breathe. How much pressure is too much? It depends on your body type and how advanced you are in your pregnancy. If you're really big, you could tip over, says Jones. For most people who are pregnant, it's just not worth the risk. And if any dizziness or back pain follows from using a yoga ball during pregnancy, as it has with some women, it may be necessary to stop exercising until you feel better. Some doctors and healthcare professionals even caution against sitting on the floor for prolonged periods of time, especially toward the end of your pregnancy. The same goes if you plan to use a yoga ball during labor or delivery. Although this is less common, your growing baby puts some pressure on your pelvic floor, and if you're not comfortable sitting on the ground for hours at a time, using a yoga ball is probably best avoided. What are the benefits? Using a yoga ball during pregnancy can still provide some benefits, according to Jones. It's great for circulation and massages your internal organs, she says. And if you're feeling restless on the inside, sitting on that itty-bitty ball might make you feel better. But don't use a yoga ball too long or too often. This is when problems start to occur. If you suddenly begin to notice back pain, dizziness, or fainting, headaches, changes in vision, vomiting, abdominal pain, or irregular contractions, stop using your yoga ball immediately. You should consult your doctor as soon as possible. Also keep an eye out for sharp pains in your abdomen, lack of fetal movement, and other discomforts that could signal labor. Also, be aware, if you have an IUD, you shouldn't use a yoga ball at all during pregnancy. The experts we talked to agreed there's no need to take such a chance. Pregnancy is already enough of a strain on your body. Is bouncing on a yoga ball safe during pregnancy? It depends on what kind of exercise you're doing and how far along in your pregnancy you are. Yoga balls, small, inflatable spheres you can sit on while exercising, are a big trend in pregnancy exercise. One study found that women who practiced yoga with the aid of an exercise ball experienced less back pain and had better posture than those who didn't. Other studies have shown that regular bouncing on a ball helps maintain strong pelvic floor muscles and balance during pregnancy. But doctors say it's important to check with your doctor before starting this kind of workout routine, especially once your belly gets bigger. Unlike exercise balls, yoga balls are often the same size as a full-term pregnancy belly. One of the most common moves performed on an exercise ball is called kneeling, and it's a hip opener. You kneel with your right knee on top of the ball and your left leg extended straight back behind you on the floor. You look like an upside-down L from here. You can bend forward at the hips to open up your chest or lean to either side for an oblique workout, letting gravity pull your belly toward your bottom foot, which helps prevent lower back pain. If this move hurts, try putting just one knee down, or both knees if it still hurts too much.